مرحبا, أنا الدكتورة أبو لبن مع الدكتور معين فضة. Today we're going to talk about some of the most common myths about IVF and some of the most common questions we get asked in the clinic. One of the most common questions we get asked is about IVF babies and the health of these babies. A lot of patients have concerns that these babies have an increased risk of congenital abnormalities, autism, or other learning disabilities. This is not true, and actually it's been proven to be quite the opposite. And this is because these patients have very special care during their pregnancies. They take all their vitamins, they go to all their doctor's appointments, and even after birth, they are extra cautious with their children, and they've been proven to be smarter and more successful than most other children. Another common question we get asked is whether the medications used during IVF increase the risk of cancers in the woman. And this is not true, and actually the evidence has proved that it is not true. These medications are highly regulated, they've been used for decades, and if there had been any problems found, they would have been pulled from the market a long time ago. Another question we get asked is about the lifestyle and level of activity after embryo transfers. And a lot of patients have this idea that they're not allowed to move after their embryo transfers, that they need bed rest. Some even think that they're not allowed to bathe, they're not allowed to go up or down stairs. Some don't even leave their home after the embryo transfer. This is not only not true, but it actually decreases your chances of getting pregnant. Most recent studies have shown that decreased movement and decreased level of activity decreases your chance of getting pregnant, and the only rest that is needed is 20 minutes after embryo transfer. Anything after that is not necessary, and it's actually worse for you. Another common misconception is that all IVF babies must be delivered by cesarean section. And there's a sentence that's used which is actually very inappropriate, which is that these babies must deliver by C-section because they are precious babies. Now, all babies are considered precious, whether they were conceived naturally or by IVF, and there is nothing specific to IVF pregnancies that requires a woman to deliver by C-section. If there is any medical reason for a C-section, then of course we would go for a cesarean section. But otherwise, they are treated like any other pregnancy. And in conclusion, if you have a question regarding IVF, please ask your doctor and not your neighbor.